Dr. Salma Nazmi. Today I wanted to talk to you about vitamin D and specifically its role in promoting a healthy immune system and prevention of chronic disease. So I'm sure you've been hearing a lot about the media buzz discussing vitamin D levels and COVID-19 since we're in this current healthcare crisis. While there have been some anecdotal studies that have demonstrated the connection between healthy vitamin D levels and better outcomes in COVID-19 patients, there is no specific data to suggest that this is the case. However, we do know that healthy vitamin D levels most definitely promote a healthy immune system, and also that deficiencies in vitamin D have found to be connected to a whole host of chronic illnesses such as diabetes, such as coronary artery disease or heart disease, depression, dementia, osteoporosis, certain cancers like prostate cancer, colon cancer, breast cancer. And that's why it's so important that we make sure that our vitamin D levels are healthy, because we want to optimize our immune system to put us at the best situation to fight off infection. So I wanted to talk about the sources of vitamin D. So we have the sun, which during the winter months, or if you live in a cold place like New England, it does become a challenge to get your vitamin D levels up just with the sunshine. We have some food, dietary sources such as fatty fish like salmon, such as egg yolks, but again, it's hard to get your vitamin D levels up with diet alone. The best way to get your vitamin D levels up is through supplementation. So what are the symptoms of vitamin D deficiency? Oftentimes patients are completely asymptomatic. They have no symptoms, but the most common symptoms that we see are fatigue, depressed mood, very, very common. Something that I refer to as brain fog, which is when patients just have an impaired ability to think through things. Their cognition is impaired. They actually come in describing that they feel like they are having brain fog. Also muscle, joint, and body aches. These are very common presentations. Also hair loss. We see hair loss too with vitamin D deficiency. So healthy levels of vitamin D are any levels above 30. When we look at the levels and find them to be between 20 and 30, we call that vitamin D insufficiency, and any levels below 20 are considered vitamin D deficiency. So when I diagnose a patient with vitamin D deficiency, I treat them with high-dose vitamin D for 8 weeks. I treat them with 50,000 international units of vitamin D once a week for 8 weeks, and then I recheck the level. And depending on what that level is, I will recommend maintenance therapy at a specific dose. For vitamin D insufficiency, levels between 20 and 30, I will treat with anywhere between 800 and 2,000 international units of vitamin D daily, depending on what part of the spectrum of that you fall into. Now, with the current healthcare crisis, there is no specific recommendation that you should be taking in, X amount of vitamin D, to boost your levels. I'm still recommending to my patients that they have healthy levels. So if they are deficient, I'm treating them as such. If they're in the insufficiency range, I'm still providing the same recommendations that I would have normally. I just want to get everybody's level up above 30 so that they're in a healthy range. If you are somebody who has absolutely no clue what your vitamin D level is, this is not the time to go out and start doing, go to get blood tests done, putting yourself at risk for COVID infection. But what I do recommend is talking to your doctor, because it's probably a safe bet to take somewhere between 800 and 2,000 international units of vitamin D daily if you have no idea where you are with respect to your level. So talk to your doctor based off of your history, based off of your age, based off of your medications. They can make the best case recommendation for you. I hope that you found this video helpful. I hope that you continue to stay safe, and there will be more videos to come. Take care.